morning, everyone. I would like to call this meeting to order. Before we begin, I'd like to remind everyone to put their phones on silent so we don't have any interruptions during the meeting. And I'd like to begin with each member of the committee introducing themselves, beginning with Mr. McGuire.
Brendan McGuire, Halifax Atlantic.
Suzanne Lunas-Croft, Lunenburg.
Margaret Miller, Hands East.
Joachim Stroink, Halifax, Shabukto.
Ian Rankin, Timberley Prospect.
Good morning. My name is Tim Houston. I'm the MLA for Pictou East.
Good morning. Dave Wilson, MLA for Sackville-Cobequid.
And today we have Communications Nova Scotia with us. The topic for today is advertising, procurement, and performance. And I'd like for our witnesses to introduce themselves, beginning with Ms. Tawil, and you can roll right in with your introductory comments.
Great. Thank you. Thank you very much, and it's our pleasure to be here this morning. With me to my left, I have Angela Campbell, Director of Policy and Corporate Services, and to my right, Hilary White, who is a financial planning analyst. I'd like to thank the Auditor General's Office to begin and their team for the work over the past year that they conducted in terms of their audit of Communications Nova Scotia. In the summer of 2011, Communications Nova Scotia began its own internal review, looking at several of the areas the Auditor General's Office ultimately ended up reviewing. We outlined that work alongside the audit, and both have led to improved processes, efficiencies, and most importantly, government being able to provide better information and services to Nova Scotians. We accept all of the recommendations in this chapter. In fact, we've completed several and have begun work immediately on many others. As you know, part of the audit scope was to determine whether CNS's activities were nonpartisan. The AG confirmed that the work of CNS is nonpartisan. In fall 2013, the legislation guiding CNS was updated, which will ensure this will remain the case. The audit scope covered an 18-month period during which approximately 16,000 projects were managed through CNS. The AG examined 31 of those projects. This is a large workload for a small number of staff who are currently spread throughout the agency. We have recognized the need for a centralized approach to project management and procurement at CNS. This approach will lead to greater consistency in monitoring projects and in how we apply procurement procedures. We very much respect and adhere to all government policies, including the procurement policy. The AG's office has also raised what they believe may be an issue under the CRA definition. We take that seriously and are consulting the PSC, Finance and Treasury Board, and if necessary, we'll seek a legal opinion. This is a complicated and technical issue. We will follow the AG's recommendations, and we will also consult more broadly to ensure it is appropriately addressed. Research and evaluation, both topics the Auditor General looked at, have been key priorities for us at CNS. We've created a centralized role for communications research and evaluation using one existing FTE. Sharing resources and knowledge across departments has resulted in better use of resources, a standard approach to evaluating campaigns and communications, and sharing of results more widely. In terms of measurement, we've adopted Google Analytics as the corporate standard, and CNS is leading efforts to track web traffic and conduct web analysis on behalf of government. We also use the Heartbeat tool to regularly evaluate social media work. Social media has in fact been a key focus for us this year. We've updated our policy and guidelines and have developed the first coordinated corporate social media plan for government. You may also notice that we've been doing less traditional advertising, for example, billboards and signs. In some cases, it may make sense to stick to traditional advertising. In other cases, we've moved toward more targeted campaigns. The online campaign around the education review is a great example of a small investment going a long way. It was easily measurable and effective. Our departments are hearing from Nova Scotians directly through social media now, in addition to the emails, letters, and phone calls they receive. Transportation and Infrastructure Renewal is one department that does a great job of engaging with Nova Scotians, sharing public safety messages, traffic advisories, and hosting discussions on topics like back-to-school safety. We will be doing more of this kind of work across departments in the year ahead. CNS, like all government departments, supports the province's goal of achieving fiscal sustainability. To that end, we reduced our government advertising budget and have implemented 2 subsequent 1% budget reductions. Furthermore, the amendments to our legislation will lead to better value for taxpayers' money. Previous to the legislation, there was no legislative requirement to have departments use CNS services. They would sometimes procure advertising or other communication services outside of CNS, creating inconsistencies in the information available and often spending more money than necessary. In the future, we'll have greater coordination across departments and offices, consistency of standards in products and services, and ultimately better value for money. The work we do with regard to these recommendations, combined with our updated legislation, policy, and guidelines, puts CNS in a much improved position to focus on our mandate to help Nova Scotians understand what their government is doing and why. And with that, I'd be happy to take your questions.
Thank you. We'll begin with the PC Caucus and Mr. Houston for 20 minutes.
Thank you, Mr. Chair. Thank you for appearing today. So your first time appearing before the Public Accounts Committee?
Second time.
Second time, okay. Well, we're glad to have you today. Just in kind of 10 or 20 words or less, could you tell me what your goal is in the department? Like, what's the department really trying to do?
Ultimately, the department is trying to help Nova Scotians understand what their government is doing and why. That is our mission, and we achieve that through a variety of communications means.
Okay. And the department has had a lot of fluctuations over the years. I know just a little over 10 years ago, this was a $3 million department that had 89 staff. Mm-hmm. And here we are, I guess, 12 years later, and it's a $7.5 million department that has 90 staff, and in between it's been much higher. I'm just wondering, how has that fluctuation of budget and staffing impacted the department's ability to deliver on that goal? Would you say the department is more effective at delivering on that goal now, or?
So maybe I'll go back the 10 years where you started. So when CNS was created, at that point in time, it was recognized by government of the day that there was a need to bring together communications resources that at that point in time existed in pockets right across the system. And so there was a recognition that a more centralized, coordinated approach to communications might help government ultimately be able to fulfill that mandate that I just articulated for you. Fluctuations in staffing and budget have occurred to some extent as a result of initially bringing together all of those resources over periods of time. So the agency initially started fairly small and then has grown as other resources were brought in. Over the past 3 years, as you've noted, our FTE numbers have reduced. We've reduced by approximately 25 FTEs, and our budget has reduced by approximately $1.9 million as well. I would say I'm very proud of the work that the folks that work at CNS do. And sometimes it is challenging with the number of resources that we have to fulfill, for example, fulfilling all of those 16,000 projects that I referenced over an 18-month period. However, using other tools such as social media, availing ourselves of research and evaluation, we are able to be much more targeted and ensure that we are achieving the objectives that we set for ourselves.
Okay, no, I just was curious for that little bit of background. I want to start with the numbers from the budget. Mm-hmm. I don't know if you have that. It's in the government budget document. It's page 20.6, I guess. But it's Communications Nova Scotia, and it talks about departmental expenses by object. And in that, for the estimate for the year that we're in right now has gross expenses, salary and benefits, $9.2 million, operating costs, $8.1 million, for a total gross expenses of $17.4 million. Mm-hmm. I guess that's all the money that's going out of the department. Mm-hmm. And then it says less chargeable to other departments, $9.9 million. Mm-hmm. For net, and that's the $7.5 million is the net the net cost to taxpayers of just this department, I guess. But I'm interested in that chargeable to other departments of 9.9 million. Can you tell me what that is, like how that works? Is that I know it's obviously charged back to other departments, but is it charged back on a fixed basis? Every department gets a certain amount? Is it variable to pay depending on how much they call you? Or how does that number happen?
That number is variable. It is, we charge back on a project-by-project basis, so it really does depend on the cost of the project that we've initiated on behalf of a particular government department, and those costs vary depending on the nature of the project, the objectives that we are trying to achieve. CNS has quite a small budget in its own right to pay for government communications efforts across all of the departments, which is why we have a model of cost recovery, where we recover from those departments.
Okay. Yeah. So in terms of, I know various departments have their own communications staff. Or do those staff, are they in your FTE number of 98 and you've allocated them out to different departments, or are they somewhere else?
They are included in that number. Each year, we reach out to departments to inquire in terms of the number of communication staff that they feel they will require for the fiscal year ahead. Those decisions are made in consultation with the Deputy Minister of those departments based on their statement of mandate and their goals and objectives for the year ahead. They make
so how many of the 98, sorry, how many of the 98 people would be people that are kind of out in those departments on a full-time basis?
I think I have the exact number here.
And when those people are, like, let's say it's the communications person in the finance department, when they're preparing like a press release or some other kind of media event, do they come back to your department and say, approve this release or do something? What's the, they're out in the departments full time, but what's their interaction with your staff?
So communicators that are assigned to departments remain part of Communications Nova Scotia, assigned to a particular line department. Those assignments can change every couple of years, but they do remain employees, if you will, of Communications Nova Scotia. The way we're structured is that we have communications officers, advisors, and directors located in departments. Sometimes there'll only be one of those individuals. Sometimes there is a team approach required to manage the communications of that department. The communications directors in line departments report into a managing director in Communications Nova Scotia. That managing director has responsibility for a block of departments, so they can keep their eye on issues that maybe cross over departments and support a team of communications directors.
Okay. So how many people are out in the departments? I don't know if you were able to get that number or not.
Approximately somewhere between 58 and 59 staff are out in departments.
So the majority of your staff are
I wouldn't say the majority. I'd say about 60% are out in departments. The rest would be people like photographers, videographers, graphic designers, marketers, the managing directors that I mentioned.
And they're in the they're in your numbers, I guess, in your 7.5 net is the cost of them. They're not in the chargeback?
Right. We don't charge back for.
So in terms of the chargeback, the 9.9 million that's budgeted for this year, like who are your best customers?
We're very popular with all departments. So you're talking about in terms of how the size of teams in departments?
Well, no, because it's variable, so that amount is going to change based on how much work the various departments ask you to do. Which departments are asking you to do the most work?
That varies on an annual basis. It really does depend on what the issues of the day are. We do work for every department every year consistently. It depends on the priorities of those departments, how much their need and demand is on an annual basis. And it does vary. It fluctuates from year to year, which, back to my earlier point about setting the number of staff in departments, that is why that number can change sometimes on an annual basis, because it really is tied to the departmental business plan, their statement of mandate, and what they intend to accomplish in the year ahead.
Okay. So in terms of the 7.5, the net number, I can see that's, I see how that's made up. Like Office of the Assistant Deputy Minister, 2 million, Client Services, 500,000. Do you have those numbers on a gross basis too? Because the gross would be like 17 million. I'm just wondering how you do kind of your costing for your charge outs. Maybe we can look for that and get that.
Okay.
Get that later.
Thank you.
But in the 7.5 net. I'm just looking down, client services, $500,000, communications planning, $500,000. Like, client services, what does that mean to you, and like, what would your department be doing in client services? Most of your clients would be other departments.
Absolutely.
So you have staff out in those departments.
Mm-hmm. So within CNS corporately, we have a unit called Project or Policy rather, and Corporate Services. Angela Campbell is the director of that unit. That unit coordinates client services and project management for all of those 16,000 requests that come through. So like any private sector communications agency, we have a central client services hub to triage.
Sense. No, I appreciate that. How are we on time, Mr. Chair?
Till 9:26.
9:26, okay. So and then we have communication services, 1.3 million, and we have marketing, 3 million. Just quickly, like communication services, is that with your customers, the other departments, or is that with the Nova Scotians?
That would be work that is done in terms of creative services, like graphic design, photography, videography, things like that.
But not charged back, you can't charge that back to a department?
Some things are charged back, yes.
But that's the net number, so this is the amount that's left over that you can't charge back. I'm just wondering how that...
CNS is a central agency like many other central agencies, and we provide service out to departments. We recover where appropriate, but in areas where government priority, for example, may rest, those are the areas where CNS, we carve up our budget and make sure that we are supporting those areas.
Okay, and now the marketing, the $3 million in marketing, who are you marketing to?
Nova Scotians.
So on behalf of various departments?
On behalf of various departments, we undertake different marketing activities such as...
But you can't charge it back? I'm just trying to get my head around like how, if the idea is that you're charging the cost back to the department, so you're always doing work on behalf of departments, and then you're doing it on a recovery basis. If the net number is 3 million, I'm assuming the gross number is 7 million. Because some is getting, but some you can't charge back. So you're marketing, and that's marketing to Nova Scotians on behalf of departments?
So there are some aspects of our budget that we earmark to support government corporate priorities. For example, some of that money would be earmarked to work in collaboration with the Department of Agriculture on the Select Nova Scotia campaign, as an example, to extend that into a more more buy local focus. So we do set aside some of our own sort of corporate marketing funds in order to market more broadly in partnership with some departments.
So how would that be decided then? So that's an agricultural thing, I guess. That would be under the Department of Agriculture for the most part. They would have come to you and said, help us with this buy local campaign.
We worked together with them to identify the Select Nova Scotia program brand had been around for quite some time, and we worked with them to identify how we could grow that brand, and it made sense to support more of a buy local focus to support our local businesses. And so agriculture would have money earmarked in their budget that is primarily focused more on the agricultural sector. We came to the table with money that could help expand that campaign, to expand our reach, and to grow the equity that that brand has developed over the years since that program was created.
So, and I don't want to focus too much on that example, but presumably that's the most, but I'm wondering where that kind of directive or decision comes from. Is that from your department looking at the various campaigns that different departments are running and then saying, you know what, we really like that one. Let's put some of our own money towards that one. Like, is that coming from inside the department or external to the department?
It can come from a variety of places. It can come from our review. We annually review the statements of mandates coming out of departments. I also talk regularly with deputy ministers of departments who are identifying areas that their stakeholders have spoken to them about where we need an additional focus. It can come from what we're hearing in the marketplace. It's no secret to anyone, if we stay with the Select Nova Scotia example, that there has been a push internationally to move more toward buy local and supporting local industry in terms of a means to try to grow our economy and support those local businesses who are contributing greatly. So it comes from a variety of areas. As professional marketers and communicators, we're always on the lookout for those things that make sense. And also, every government sets priorities in terms of where their focus is going to be. So understandably, as a corporate central agency, we too need to make sure that we're paying attention to those corporate priorities.
Okay. I want to talk a bit about opinion research and kind of focus group research that's done. So I don't know if is polling a word you would use, or do you have a better term for how that
I know
happens?
what you mean.
Okay.
Research and
the right word,
evaluation.
though.
Yeah.
Polling seems to have a negative connotation. I wonder if there's probably a different word you would use.
Research and evaluation is.
So for research and evaluation, would it be fair to say that there are a few subcategories in there? One would be kind of public opinion polling in advance of a decision or a policy being made.
Absolutely.
And then there would be kind of research done maybe afterwards to see if a program's working.
Yes, absolutely.
In terms of, and just a general question without really getting down in numbers, in terms of the work that you do in research and evaluation, is how would you split that between the percentage that is kind of opinion polling on what should be done as opposed to research on what has been done? Is that an easy question, or?
I would say it's not, it would be hard for me to sort of split it on a percentage basis, and certainly you've reviewed the Auditor General's chapter on research and evaluation as it pertains to Communications Nova Scotia, so you would be aware that that's an area where the Auditor General flagged that we need to pay closer attention to make sure we're setting measurable objectives, that Communications Nova Scotia is involved in all of those types of projects, and that we are regularly evaluating along the way. I would say that we have some growing to do in that area, which is why we've dedicated in the last 2 years, dedicated a resource to focusing on research and evaluation.
So there was some, sorry, that's helpful, I appreciate that. So there was some research done recently on the whole northern pulp situation. Was it your department that did that?
It was,
That
yes.
type of, and so a request like that would have came from where?
The request for that came from the communications teams, the various departments that were involved, working together to say, we probably should do some polling on this particular issue to get a sense of the level of awareness around particular actions that had been taken by the Department of Environment to address some of the concerns in that area.
Okay. Okay, that was all very helpful. I appreciate that. just took up more time than I thought. So I just want to talk about it like, let's use that as a good example. So the decision was made to do some polling. They come to you and talk to your department about that. How do you decide who to hire, who to engage to do that actual polling?
When we conduct polling, we prepare a statement of work, and we seek 3 quotes from researchers that work in this market that are on the communication standing offer. We then evaluate the product that they're offering
Yeah.
to return to us.
And then who would
determine-
decide the actual kind of questions that would be asked in that poll? Would it be the people you hire?
They would provide expertise given their experience and the fact that they specialize in research and evaluation. We would work with them to sort of land on those questions. That would be the communications teams in the particular departments that are involved, as well as individuals within Communications Nova
And
Scotia.
if they think that some of the, if the third party comes up with some questions, that who would determine whether or not those questions are too political, too partisan in nature?
I would.
You would, okay, and then you would go back to the firm
Yeah.
and say, change these,
Yeah.
yeah. And then after that, it would go back to the department for them to weigh in on?
Well, the communicators, the CNS employees that are assigned to departments are involved in this work all the way along. So it's very much an iterative process. So they would be having conversations with their program area experts as well as their deputy ministers to make sure that they were fully apprised of the work that was being undertaken.
Order.
Okay.
Mr. Houston, your time has expired. We will now move to Mr. Wilson and the NDP Caucus for 20 minutes.
Thank you, Mr. Chair, and thank you for coming in today. I'll try not to go over some of the questions my colleague has asked, but I do have some follow-up questions in some of the areas. So I know you mentioned, I think the budget, the overall budget is about $7.5 million for your department. Knowing that other departments have money set aside for advertising and that. Can you tell me what the actual advertising budget for, I don't know if you can tell me this or not, for the overall government? So government advertising, how much did we spend last year on advertising? Do you have that figure in front of you?
I don't, and the reason I don't have that in front of me is because prior to the introduction of our legislation, advertising was not centralized and run through Communications Nova Scotia. And so it was very difficult for us to put a finite number on globally what was spent on advertising. Now, by virtue of the elements that have been added in through the CNS legislation, the Minister of Communications Nova Scotia will have to table on an annual basis an advertising report that will show exactly what advertising has been done. And in instances, if a department were to inadvertently forget that they need to come through Communications Nova Scotia to procure their advertising, those ministers will need to explain why that has happened. So we'll be in a much better position, I guess, to close this response off. We'll be in a much better position by the end of this fiscal year to have a better handle on exactly what government is spending on advertising.
So is that information going to be attached to like the budget? Like, is there a timeline? Because often it could be within the year, and then often we see it's towards the end of the year. So is there a timeline?
The first accountability report will be tabled in April.
April. Okay.
So
Thank
once we've been able to tally all of the numbers, we'll absolutely be providing information on the advertising that we conducted, both from a financial perspective, but for significant campaigns, we'll also include in that report the objectives that were set, how we set those objectives, and what we achieved at the end of the campaign.
And I know my colleague had mentioned a figure around $17 million, so I assume it's quite a significant amount of money. Are you aware? I know the government, when in opposition, actually was in their platform. They announced that they would reduce government advertising by $5 million. So that's a significant undertaking, especially even if the budget's, let's say, $17 million. So have you been given any instructions so far on, I know you have mentioned the reduction of 1% in your department, but I see the $5 million as something separate. So have you had any discussion with the Premier, with the Minister that oversees your department about achieving that $5 million reduction in government advertising?
We have reduced our CNS corporate advertising budget by $600,000 this fiscal year. Once we have a good handle on what government is spending overall on advertising, I would fully expect to see further reductions in that area.
Okay. Because, I mean, with say the 3 years remaining, you're looking about a $1.6 million reduction each year, so it's significant. So, you know, it's something we'll continue to keep track of. You had mentioned that there was a reduction in staff, and I know, speaking with the former minister who oversaw your department in preparation for this, that there was a lot of work done to try to reduce the number of CNS employees within the government, and you said you're down about 25, I think. There was 130, I believe, at the peak, from my understanding, in the previous administration. What number are you at now with CNS employees?
Our published estimate is 97.7.
And
FTEs.
over the past year, have you reduced any within the last year? I know we're not fully finished the fiscal year, but over the last year, have you continued to reduce numbers within the department?
Yes, we have. We absolutely have, and we are also abiding by the government's directive on 1 for 2 hiring. So for every 2 vacancies, we can only staff 1 position. But above and beyond that, back to my earlier comments in terms of where the needs are, when we speak about communicators that are assigned, for example, out in departments, we continually assess what those needs are, and if the need isn't there, we will either move staff to where the greater need is, or we will look to reduce positions where appropriate.
Okay. How many vacancies do you have now? Do you know what the number is?
Just 1 second, I can give that to you.
Well, when you get that, you can give it to me later. It's
Okay,
not,
thank you.
And your answer kind of leads me into my next kind of line of questioning. I mean, coming from a department that I oversaw, there was a lot of need, I think. There was more than one communication individual in the Department of Health. I think of all the departments, that department, especially over the last number of years, with the number of things and initiatives that were important to make sure that Nova Scotians knew what to do and how to access care. I mean, just in the last 4 or 5 years, we had the 811 program where nurses are on the line for try to help people, ensuring Nova Scotia know about the competencies of our paramedics, for example, to call 911, the H1N1 crisis, immunization programs, the new model in CEC. So there's a lot of information and changes in health. So health definitely, I would think, would be one of your leading clients, I guess. I think that's what you call the customer within your department. And we know in 2010, after Dr. John Ross did his report, that one of the major themes in his report was to ensure that government had an effective communications with Nova Scotians to ensure that they knew what was going on in emergency care in Nova Scotia. So through that campaign, what kind of advertising would have, you know, I mentioned a few, I guess, but what kind of relationship do you have with health, and what work is going on now on the communication needs for that department?
Well, you very accurately have articulated some of the many challenges that department faces, and I guess the great communications opportunities as well. There are a few things that matter more to Nova Scotians than the health system. 811, 911, those areas remain an area of focus for the Department of Health. As you are all very well aware, we are also working through the amalgamation of the district health authorities, which also presents a communications opportunity to talk with Nova Scotians about the changes to a system that they very much value. So we've been working collaboratively with the Department of Health to determine what are the most effective communications means to reach Nova Scotians rather, to ensure that they understand what those changes will mean to them. Work in many of the areas that you referenced, work continues, it's ongoing, because the need is ongoing. We also have targeted specific groups within the populations, like seniors, for example, to help them, to ensure that they do understand where and how they can access services. It's an ongoing challenge and priority and opportunity, I think, for us to connect directly with Nova Scotians.
I know my colleague mentioned this, the research and evaluation, or the polling and focus group. We know, I think I asked the minister this question earlier this week or later last week, around some of the focus groups and polling that was going on around the amalgamation of the district health authorities. So do you have a total number of what has been spent so far on those research and evaluation or polling and focus groups specifically for the amalgamation of the district health authorities?
I have that number here. I can pull that for you. And if I could just say, we felt it was necessary to do a bit of research on this particular issue because it is significant, and there is the potential for there to be a lot of misinformation out there or misunderstanding about what the change will mean to people on the front line in terms of how I, as a consumer of the health system, how I access the health services that I have always accessed. So going out there and doing a bit of research to ensure people are aware of the changes coming and to look for the areas where maybe we need to communicate a little bit more, or maybe we haven't been, or maybe we've over-communicated, as an example, in a particular area. That is why that research was undertaken, and you know, in collaboration with the department, we'll make decisions on how much more research we need to do. We have questions that are running regularly through omnibus polling so that we can gauge the level of understanding out there about this particular issue, and we may look to do targeted communications to speak directly to seniors, for example, to ensure that they know the health care they need will still be there when they need it and how to properly access this vital service.
So during my questioning to the minister, I know in the past he's mentioned that he's taken a tour around the province, but one of the areas that I haven't seen any advertising on or was kind of public meetings. We know that there's been some polling and focus groups going on. So was there any recommendation from your department or your staff to Department of Health that community public meetings need to happen so that you can engage community members on another level other than maybe the polling you're doing through the telephone, internet, or however you're doing it? So was there any recommendation to do public open meetings with public, especially in the rural areas, around the amalgamation?
We work with the Department of Health, who is ultimately responsible for implementing the policy direction of government. We do take direction from them in terms of the areas where they feel they need to consult, where they want to do some research and evaluation. I couldn't say specifically if the communications team I have assigned to the Department of Health made that recommendation or not, but I will say work is ongoing, and it is a priority of the transition team that is working on the project within the department to make sure that the public is engaged throughout the process and is made aware of the changes as they occur, but also that others who work within the system, within the department, are also aware of the changes that are coming.
So if I hear you correctly, as the Associate Deputy Minister, you haven't heard of that recommendation, but it might not mean it hasn't happened, but
Exactly. There's a lot going on in all of the departments, so I try to keep abreast of everything, but I might
That's
have
fair.
missed a conversation
Okay,
that
that's
occurred.
fair. So with the information and the data you get from the polling, from the focus groups, what do you do with that? You evaluate it, I know you just mentioned that do we need to do more communications on a certain aspect of the amalgamation, for example? Do you provide all that information to the government or to the department? Is that information available to the public? Is it posted somewhere? Is it online? I mean, is that what you do with the information once you find the results and the information that you compile from doing that polling?
We do a variety of things with the information that we gather. We use it to develop strategic communications plans. We use it to develop marketing campaigns to go out to market. As one example, it's not necessarily a health example per se related to the district health authorities, but we have worked collaboratively with the Department of Health on road safety, for example, and risky behaviors that our youth engage in terms of driving, speeding, driving while under the influence, etc. When that research comes in, we take a look at it and really evaluate, okay, what makes sense to try to get at some of these behaviors that we've identified as being a problem in society. I think it's important also to note that we as an agency have been conducting research and evaluation since at least as far back as 2006. So from a best practice perspective, any communicator kind of worth their salt is going to push for research and evaluation to frame up a campaign before you go out there and to evaluate its success once you're out there. And if you can do it, you should be evaluating throughout as well. And sometimes that's all of these are challenges financially sometimes because research is, can be costly, which is why we're looking at other means to reach people and gauge their opinions as well.
So I know my question was a little bit more open, so I'll be more direct. So is that research available to the public? If the public is concerned about amalgamation, for example, let's use that, can they get access to this information, and will you make that public through some means within your department?
At this point, the research that we conduct is not available publicly other than through a routine access request or a FOIPOP request. However, I will say that we've been having a conversation of late around should we be making some of this information available through our website. This could take me down a whole other track, but the government website, I think, needs to be a place where people can go to get information that is relevant to them, that really tells them what government is working on. And so information like this some level of it might be useful to be making available a little more broadly. So we're having those discussions now.
Okay. So I know it's been the practice not to make that available, but would it be as easy as the minister indicating that yes, that should be made public? Is it that easy? Is it that simple? The minister says to you, yes, make this information public. Is that something that could be done relatively quickly?
That would be one element of it, but the other element I would say is that we don't conduct research ourselves. We engage with private sector partners to conduct research, so we'd also have to collaborate with them and ensure that the contracts and the statement of work that we have in place with them would allow us to share some element of the research that we've conducted. So it's not as simple as sort of one conversation. The other piece we'd have to look at is sometimes putting out raw data, for example, without any context around it can be problematic. So we'd need to look at exactly what we would share. I'm saying that it's a conversation that we're having. There are a few things we'd have to look at, though, before we could sort of flip the switch on that.
So I know in other departments, I don't know if it was under environment or natural resources where they did some polling on the mill in Pictou County. How many other departments, are you able to tell us a percentage of, for example, how much the Department of Health is spending on polling and focus groups compared to the overall number of departments that are doing that work? Is there a lot of departments doing focus groups and polling now, or is it just a few, and is it just when there's an issue come up that's that seems to get the attention of the public?
It really does, it varies. Again, and I don't mean to sound like I'm being vague or anything, but it really does vary because it depends on issues, as you've just articulated, issues that sort of pop up in the public domain where we're suddenly sort of called to provide some level of communication support. Sometimes it's on issues that the department has planned for. So within their business planning process for the year ahead, they know, to go back to the road safety example, Department of Health and Transportation and Infrastructure Renewal knew that road safety would be a priority for them this year. So conducting some research in that area to really get a sense of how to most appropriately tackle that issue makes sense. But there are a variety of departments that engage in research. Now that we have centralized that function as well, and there's an element of our legislation that speaks directly to CNS having responsibility for communications, research, and evaluation, we should also, like advertising, have a much better sense of the level of research and evaluation that's going on across government.
So I know we've put some FOI pops in around the focus groups and in polling. I know if you don't cover everything, you only get very specific information. So can you tell us the amount of money spent so far in the Department of Health on focus groups and polling?
I think I have that. Where is it? Just one second here. I just want to make sure I give you the correct number.
I'm done.
Oh, here it is. I'll have to give that to you in a second. It's just not broken out in a way that I can provide it to you easily.
Okay, thank you.
Thank you, Mr. Wilson. Your time is just about to expire, so if you're okay, we will move along to the Liberal Caucus and Mr. Rankin.
Hi.
Hi.
Thank you for coming in this morning. I guess I'll continue on with the same theme there. The numbers on polling, I understand you don't have the exact figures. Has there been any effort on diminishing that cost on polling with since the new legislation? And I understand advertising has gone down by 600,000, you said. So would it be fair to say that the polling has continued the same? Has it grown in cost, or has that gone down?
Right now, where we're sitting at in terms of costs spent around research and evaluation or polling, we're down over last year. However, I would throw in a caveat there. Prior to the introduction of our legislation, we were not tasked with handling communications research and evaluation across all departments. So I would fully expect that that number will grow over the course of this fiscal year because we've centralized it. Now, through that centralization, we will certainly see more effective research and evaluation and less duplication of effort. Our research and evaluation advisor provides advice in terms of, advising departments. You don't really need a full poll, for example, on this particular issue. When a running question through regular omnibus research is much less expensive and can achieve the same objective. So over time, I think we will see a much more consistent trend. But at this point, again, it would be very challenging for me to put a figure on historically what government overall has spent on communications research and evaluation.
Okay. So it sounds like the long-term goal is to become more efficient by centralizing it.
Absolutely.
Okay, so with that legislation, which ties to the first accountability report that you mentioned, would this be the first type of reporting to the legislature that in history for this department?
Yes, it would.
Okay. And are you able to give some palpable examples on how this would affect the average Nova Scotian?
Sure. What I would say is our legislation, first and foremost, if I could start just within government, really clarified the role of Communications Nova Scotia and now compels departments to use our service offerings. Our goal in doing that is to reduce overall government expense in the area of all things communications. From a public perspective, what I would say the public will see over time is certainly increased accountability and transparency in terms of what is being spent on advertising. We've published government's advertising guidelines. They're available on the government website, so Nova Scotians can certainly take a look at that. By virtue of our legislation, we also have more authority around government's social media or presence as well. So I would expect Nova Scotians over time will see government more present where they are in various forums, venues, Facebook, Twitter, etc., where we've maybe not been as visible as we should be, and we've maybe not been connecting with Nova Scotians the way we should be. The last point I would make, I guess, is that CNS also has responsibility for the overall brand of Nova Scotia. So prior to the introduction of this or the amendments to our legislation, efforts were made to try to gain a bit of control over all of the unique identifiers. We have had thousands upon thousands of unique identifiers out there across government. What those unique identifiers have done effectively is to confuse the average Nova Scotian who doesn't necessarily know that this particular program or service is something that their tax dollars have paid for and that might be available to them and that they should take advantage of. By streamlining our government branding, by virtually eliminating unique identifiers, we will first of all save money because we won't be spending money designing something unique for every single program and service that is created or offered by government. And hopefully over time, we will also see an increase in the level of awareness for those programs and services. And ultimately, that is our goal.
Okay. So those sounds like some pretty good key performance indicators with advertising. I'm wondering what the effectiveness is of your IT system in terms of tracking and monitoring the external business tracking that you have.
We have recently implemented Google Analytics as the government standard for tracking our online activity, if you will. That platform allows us to evaluate who is going where on our website, what areas they're visiting, and how long they spend there. We have also, working with our partners in Service Nova Scotia, we've also conducted some research in terms of Nova Scotians' comfort with conducting transactions online, which will be helpful in terms of what other services we may ultimately move to an online platform. And from a social media perspective, we use a tool called Heartbeat to monitor what is happening in that other sort of world that has been foreign to large measure to a lot of government departments. So we've tried to put a number of measures in place, updated government social media policy, and for the first time have a government social media plan as well.
Okay. That's okay. That's all I have for now.
Thank you, Mr. Rankin. Ms. Miller.
Hi. Thank you very much for coming. It's been very interesting listening to you, and I can see how passionate you are about the work that you do. It is really great. And talking about social media a little bit, and I can see you really moving in that direction, and predominantly, although a lot of us older people are getting into that as well, it's a young people's market. So what have you had any targeted campaigns towards young people?
We absolutely have. And I can talk about a couple. To go back to an earlier example, road safety. I'll talk about that one for just a moment. We recognize that risky behavior while driving is an ongoing and very pervasive issue. But I can remember what it was like to be 16, but really only vaguely, to be honest. So it was really necessary for us to go out and have some very focused conversations with young people to ensure that we understand exactly why they partake in some of the risky behavior that they do, and how we might be able to reach them and try to affect a level of change. And so you've asked me specifically about targeting young people. We've embarked on a campaign that in fact, first uses more traditional means to reach them. We've started a motorcycle safety campaign that speaks directly to some of the issues that came out through our research around risky driving, excessive speed, not wearing seatbelts, things like that, and how they affect those that drive motorcycles. So we went with a traditional approach in that way because the research directed us in that direction. From a social media perspective, we will also be starting more online campaigns to target youth and to help them sort of realize that some of the behaviors that they are partaking in, driving while under the influence of drugs or alcohol, how risky they are. Texting while driving, how risky that is. So we've certainly moved much more of our focus as well to an online forum where it's appropriate. Certainly speaking to young people, most times it is very appropriate for us to be online and to be where they are and to speak a language that will resonate with them. The other example I would give would be a campaign that we conducted around student assistance. So we wanted to make sure that students were aware of the student loan program and how they could avail themselves of that program. Research told us that some students weren't aware, their parents weren't aware of how to access that program to their best advantage. And so we targeted them through online sources. So using some of our other research that we have available to us from a media buying perspective that tells us who is where and what they're looking at and why they're there, we were able to develop a campaign to try to reach those students to ensure that they could have access to a program that would benefit them. We had a click-through rate on that online media that far exceeded industry standards. So an industry standard in terms of a successful kind of ad, a click-through rate would be 0.01% click-through rate, and we achieved around a 2.6% click-through rate, which tells us a couple of things. One, that the campaign was successful, but two, on the other hand, it tells us that we have a lot of work to do. So if we had that high of a click-through rate, it probably indicates that people maybe weren't aware that the program was available to them. So it is an ongoing opportunity, I guess, for us to continually communicate to students, to seniors, to all Nova Scotians, to make sure that they are aware of those programs and services available to them, and that we reach them where they are.
Thank you. Pass it on to my colleague.
Ms. Lonis-Croft.
Thank you for being here today. When you're planning for a special promotional item, say an event being carried on by the province, does the department sit in on your planning? Is there a member of the department that sits in on your planning and communicating what messages they want sent in the promotion?
Absolutely. That is part of the reason why I think the Communications Nova Scotia model works. The communicators that are assigned to line departments develop relationships and expertise with the subject matter of that particular department. And so when it comes time to develop any sort of, be it an event or any sort of marketing campaign or promotion, those communications staff, along with their program and policy colleagues in the department, are integral parts of the development of any campaign or promotional effort.
So is any of the scripting done by the department itself, or is that done completely by CNS people?
Departmental program experts will provide guidance in terms of the very specific and technical aspects of a particular issue or event or challenge or opportunity that we may be trying to manage. The communicators will then take that information and ensure that it is understandable, that it is factual, and that it will speak to the audience that that department is trying to communicate directly with.
So who gives the approval for the final message and the final product?
It's really a collaborative effort. So in the instance of, say, a news release that we might be issuing, that is an iterative process that begins first at the department level with a communicator working with a program expert to develop a news release. So we've identified that we're increasing funding, let's say, to a particular program, and we need to publicly announce that. We've decided we'll do it through a news release and a press conference. That communicator will work with the program, the subject matter expert, to determine what are the salient points that need to be included in that news release. They'll draft that news release, seek full approval throughout that department. It is then sent to the managing director that I referred to earlier. That managing director will review it as well for everything from grammar to, and question even some of the content to make sure that it is factual and it is achieving the objective that has been set. From that point, the release is then edited by a team of professional editors, and then final approval, it is sent back to the department, and final approval is sought from the department.
And the managing director works for CNS?
CNS, yes.
Okay. So does it ever happen that an item goes to the department and they say, no, go back and do it again, or we would like you to put this in?
Sometimes, after the release has been edited, sometimes there will be a back and forth, because sometimes an editor or the managing director will look at it and decide, I think this line would make more sense if we rewrote it in this way. Well, sometimes doing that will compromise the meaning or the intent that the department wanted to try to get out there. So it very much is an iterative process to make sure that at the end of the day, the release that goes out on the wire is factually accurate, has been approved by the department. We make sure that that is documented, that approval is documented, and that hopefully we've been able to communicate exactly what our objectives were in putting out that release.
So it would be quite common for a department to come and say, I would like a message on this topic?
Absolutely, yes. CNS is a central service provider. We exist to serve government and the line departments within government. So it's absolutely the ideas in terms of the vast majority of news releases that we issue come from the work of departments in serving Nova Scotians.
Okay, thank you very much.
Mr. McGuire.
Thank you for coming today. So I'll just jump right into it. I was just taking some notes as you were answering some of the questions here. So you said that the department is down 25 full-time employees over the last couple of years. Mm-hmm. Has there been an increase or decrease in part-time or contract employees within the department?
CNS regularly uses our communications standing offer when the volume of projects exceeds the number of staff that we have available to fulfill that work. We follow consistently the same process whenever a project comes in. We first look inside the agency to determine if we have the available resources to fulfill that project. And when we do that, we're looking at a number of factors, not just if we have the staff available to do it, but also we need to make sure that we meet the client's deadline, that we can deliver that project on time and on budget.
So is that a yes or no?
It varies greatly.
So if over a 12-month period, if we're down 25 full-time employees, how many contract and part-time employees are we, on average, seeing coming into this department?
It really does vary. We hire contractors on a project-by-project basis.
So once the project's over,
they're gone.
they're gone? They don't stay for an extra 6 months or a year?
They're gone. It's a project-by-project basis. And I know one of the issues that the Auditor General flagged that we need to take a look at is are those contractors coming in and doing work that perhaps should be considered more of an employee versus a contractor? We take their observation very seriously and are taking steps to look into that with our colleagues in the Public Service Commission. and Treasury Board. I would say that when we hire a contractor from our standing offer, when we bring someone in to perform a function, we are establishing a business relationship. We follow the terms and conditions of our standing offer, the tender process, or the tender contracts, et cetera, to make that happen. But clearly, the Auditor General has flagged that we need to take a closer look at that, so that's what we intend to do.
So you brought up the Auditor General. I think there was 10 recommendations. Is it 10? So how many of those have you fulfilled, or how many of those do you feel that you've adequately fulfilled?
We've accepted all of the recommendations.
How many have you implemented?
I'd have to count how many we've actually implemented, but I would say, she's going to count, but I would say probably half. We've already implemented
So
and
5 out
put
of
a
10.
process in place. Yes,
And working toward the other 5? Or?
Yes.
Okay. And
By next year.
by next year,
Yes.
so all 10 recommendations by the Auditor General will be in
Yes.
place by next year.
Absolutely.
So there's a few things. I have about a minute and a half.
Minute and a half.
Minute and a half. So there's a push toward, I guess, from what I've gathered from you, away from traditional media and kind of into the social media side. The social media, the Twitter, the Facebook, is that as expensive, or is it cost as much to advertise on social media compared to traditional media?
It's much less expensive to advertise using that medium. And
So this is a potential cost savings?
Absolutely.
And that's,
absolutely. And we will use that medium as much as we possibly can. The caveat would be we will use it where it makes sense to use it. Sometimes it's not going to make sense to use that medium to reach the audience that we need to speak with.
so the media that you're using is the traditional Facebook, the Twitter, and everything else?
We use everything that's available to us, absolutely.
I have more questions, but I guess I've run out of time, so I'll wait till the next round.
Okay, okay. Mr. Houston for 14 minutes.
Thank you, Mr. Chair. We started off with talking about the goal of the department, and I think you said that the goal of the department was to tell Nova Scotians what the government's doing and why.
Yeah, help Nova Scotians, yeah.
And then when we came into the polling on Northern Pulp, you mentioned that was a poll that came up because you wanted to understand, or let's say the department wanted to understand what Nova Scotians knew about what the department was doing. That was kind of the purpose of the poll.
Yep.
And that was the Department of the Environment.
It was,
That
yes.
would have
Yeah.
came to you and said, hey, we want to do a poll on this to see what people know about what our position is. Do you remember specifically what their goal was on that poll?
It was a collaborative effort of not just the Department of Environment. CNS, we were involved in terms of also flagging. This is probably something we need to do a little bit of research on, and there are a variety of other departments who are working to ensure that that issue is properly addressed.
Like which other departments?
Department of Natural Resources, Communications Nova Scotia, Environment. The Premier's office is aware of the work of Communications Nova Scotia and the elements that we engage in, like they are with all
So a bunch of people
departments.
got together and said, we better find out, we better do a poll to find out what was the short goal of that poll.
The short goal of that goal, or that poll rather, was to determine if residents in that area were aware of the ministerial order that had been issued, and if not, it was for us to prompt us to think a little bit, should we be communicating more about the elements of that ministerial order? It's clear that there was concern in that community, and so it's necessary. We wanted to make sure that if we could allay those concerns even a tiny bit by communicating more about that ministerial order, then we wanted to make sure that we did the responsible thing and did that.
And allay the concerns would be if the polling suggested that the ministerial order wasn't, that it was known, but that it wasn't alleviating the concerns of the community, then presumably the department takes that and figures out if they should do
we'd
more.
we'd have to think about, are there other things that we should be doing?
And I think some of the questions of that poll were exactly of that nature as to what else would you like to see your government do? Do you remember specifically?
I don't remember all of the specific questions.
So in a situation like that where you have, let's call that a sensitive polling that could ultimately lead to policy decisions, there would be back and forth. Would you remember, was there a lot of back and forth on the construction of the questions of that poll?
There was a level of, I would characterize it as you have, absolutely a sensitive issue, but I would suggest that any time we talk to the public about anything, it is a sensitive issue, and it's one that we take very seriously. The level of back and forth really varies. It varies greatly.
So would the minister be the person who signs off on that? Like in this case, I would say the Department of the Environment would have been the lead, presumably, because you were talking about a ministerial order issued by that department. Would the minister sign off on that and say, okay, yes, now I'm happy with these questions?
This was corporate polling, and it was signed off at a communications and a program level.
Okay, okay. So it's probably quite, the back and forth between departments and communications is probably, that probably happens every single time, right? I would say
Absolutely.
that's probably pretty common. And is it pretty common for a minister to get directly involved in that?
It would vary, but I would say no, it would not necessarily be the norm, no, for ministers to be involved.
Not that they'd be talking directly to you, but probably they'd be signing off.
I can't speak to what happens in a line department, but we would never proceed with polling on behalf of a department without knowing that that department had approved that polling.
And that approval comes, that's a written approval of a sign off on those?
It's sometimes
questions?
written, it's sometimes verbal. The Auditor General has certainly flagged that approvals sort of generally need to be written, and so that's a recommendation again that we're taking seriously, and we'll make sure we have documentation that denotes approval. They specifically focused on news releases, I believe, in this, or anything going out to the public, I guess, in their report. But we are putting processes in place to ensure we have that documentation across the board.
Over the past year, would you say that you're finding your department doing more opinion polling, or less, or the same, or?
Again, back to my earlier points, prior to this year, we did not have overall responsibility for research and evaluation. So it's very hard to do, it's kind of an apples and oranges comparison.
So it's a big thing you've taken on.
Yeah, I would suggest yes, and it's something that the Auditor General has also flagged as something that's really important and warrants consideration and a focus.
Okay. It's such there's so much potential for partisanness in what you're doing that I really want to kind of focus on that. Because I know at one point I read somewhere shortly after the election last year where the Premier was talking about trying to return the department to its original intent, which at the time he described as being providing access and information to Nova Scotians about the government services that are available to them.
Yep.
So that's a very specific thing, because people only care about what impacts them.
Absolutely.
And so and I'll be honest, I'm having a hard time articulating, and there's a big difference in my mind that I'm having trouble articulating between telling people what the government is doing and showing them how it impacts them. So in other words, if you put a press release out that there's a program that's $10 million for whatever, and then but really individuals can get access to $500 of that. Those people that are going to access that $500 are never going to read that press release. So that press release is pandering to a certain audience. that's not the audience of the program. So I'm just wondering, like, how do you,
Okay.
you see, you understand what,
I
what's
think
troubling me?
I think I know what you're asking, absolutely, but please stop me if I'm not responding to the question that you articulated.
Which I did not articulate, actually. Thank you for
I
being
didn't say
kind.
that. First, I would say the findings of the Auditor General's report, the period that they looked at, they clearly said that the work of CNS is nonpartisan. The legislation brought forward last fall will ensure that our agency does remain nonpartisan, and I think some of what you're articulating actually builds the case for why we can't simply communicate using one tool. So a news release, for example, absolutely there's an intended audience for a news release, and that is our colleagues and partners in the media. The media play a vital role in terms of taking that information, distilling it, asking questions, and communicating directly with Nova Scotians through the means that they have available to them. But that's only one tool. That's why we need to embark on things like marketing campaigns. That's why we need communication strategies that bring in a bunch of other elements. That's why we need to be seen online, directing potential students to the student assistance website. That's why it's vital that we don't just necessarily rely on one tool to get those messages out there. In terms of helping Nova Scotians understand the how something will impact them, we do the best we can to provide that information, and we're working to try to be better at that each and every day. At the end of the day, however, it is a very individualized sort of perspective. So what a particular program means to you and what it means to me could be two very different things. Our job is not to tell Nova Scotians what to think about something, but rather make sure that we're making the information available so that they can draw those conclusions themselves. And we need to do that through a variety of channels.
No, that's helpful. I appreciate that. The minister has a communications background. I think that's what he did before he was in politics. Is he pretty involved in the operations of your area, like looking at releases, or how do you keep him abreast on things you're trying to do?
I talk with the minister on a very regular basis, over the phone, through email, and we meet on a very regular basis about the business of Communications Nova Scotia. Yes, you're correct, he does have a communications
And is he
background.
pretty, how do you keep him abreast on your progress in implementing the changes to fix the issues that the Auditor General found?
We meet every 2 weeks and talk through all of that and a variety of other issues that the department would be working on and tackling.
Okay. Does he, do you talk to him about the procurement processes? Like, does he weigh in on, like, wow, that tender surprises me, that tender was that much? Is there another way to do it? Does he get involved in looking at the procurement side of things?
He's been very clear in saying he expects the agency to operate efficiently, effectively, to save money where appropriately, and to fulfill our mandate.
Okay. So the results of the Auditor General, the report around the procurement, how would you describe your reaction to seeing his findings? What was your first emotion?
Well, my first emotion was this is an area that we need to take a look at. Clearly, if the Auditor General has flagged that there were even minor issues with any of those procurement activities, we need to take a look at it. From a contextual perspective, 32 projects were looked at out of 16,000 projects that ran through the agency during that particular period of time.
But the art of sampling is such that you can extrapolate that, and it was pretty dreadful, the results, I think. Would you say, is that a fair word?
I would not use that word, no.
Okay.
What I would say is it's an area for improvement, and it's an area that we are absolutely focusing on, and we're working with our colleagues in procurement to make sure that everything we do, every service we procure, that it is beyond reproach.
84% of the samples had problems.
Of 32 samples of 16,000 projects, yes.
So of 16,000, probably 84%,
Well,
if they're representative. But I don't want to dwell on that. I'm glad to hear that. I hope it's being taken very seriously.
It absolutely is.
It sounds like it might be. But particularly around the staffing issue, you have less staff now, probably as many or more projects as you ever had. So you're going to have to use more contractors and more third parties to get the work done. That's just kind of a fact of life. And there was a lot of kind of troubling things around the use of contractors, particularly with the Revenue Canada concerns and stuff like that. So what is there a core group of contractors that you? How many people are in that core group of contractors that tend to get kind of the same projects over and over?
We don't really have a core group, I wouldn't call it that. We have a number of vendors that are on the communications standing offer, which would be the first place we would look when we need to procure services outside of our core complement. If I could just go back for a second, at the beginning of your question, you said it is inevitable, I guess, to summarize what you're saying, that we will need to use more contractors to get the work done. I wouldn't necessarily draw that conclusion. I think the conclusion I would draw is that we have to start looking at doing things differently. So we maybe can't use all of the same, traditional media, for example, that we've always used. We can't approach things the way we always have. Yeah. So I would suggest it's a combination of using the standing offer when we determine that we absolutely need to, when we've exhausted our internal capacity to fulfill a project, but also taking a step back and saying, do we need to do this, first of all? Do we need to do it this way? And are there other ways that we could achieve these objectives in a more cost-effective manner that is less staff-intensive, but ultimately still achieves those objectives and is an efficient use of taxpayers' dollars?
Order. The time has expired. We'll now move to the NDP Caucus and Mr. Wilson.
Thank you, Mr. Chair. So I know I talked a little bit about some of the campaigns, especially in health. Most of my career in this place has been dealing with health. So I know this time of year, for example, I've always taken one for the team where I'd roll up my sleeve and get a needle for the flu shot. So are you aware of your staff working on a campaign for the flu shot and immunization of Nova Scotians to encourage them to get the flu shot? Because I know it's usually around October that happens. Are they working on that now?
They are, absolutely, and we will be rolling out a campaign similar to others that we've done to encourage Nova Scotians to get their flu shot.
Are you encouraging the Minister of Health to have a camera on him as he gets shot in the arm?
As previous health ministers have done, absolutely.
Okay. I want to go back to something you said earlier on the line of questioning around possibly making public some of the information on polling. And kind of thinking back at what you said, you had mentioned that you would have to put context to what you receive from that polling, and I'm a bit concerned on why you would have to do that if what you're polling is what Nova Scotians are telling you what they think or what is wrong. So why couldn't you easily put, if you have a question to Nova Scotians, what do you think about amalgamation of the district health authorities? Why couldn't you just put their response on what areas they're concerned with? I'm concerned
I think
with that.
that's what I meant when I said context. So we'd have to provide enough information that people could make sense of what they see. So we couldn't just put a result, for example. We'd need to include what was the actual question that was asked and what were the objectives in conducting this research, if that helps to clarify.
All right. Thank you. And I guess it might be a line of questioning we'll be going after the Minister on, because I think it's important that Nova Scotians see what concerns them, especially if they're being asked, on certain topics. And I think it's an onus on the government to make sure that information is public and that you shouldn't have to go through FOIPOP to find it out. Polling. Was there any polling done or focus groups done on Bill 1 that recently passed this House? Are you aware of any polling that took place?
No, I'm not, no.
So I would think, since you are the Associate Deputy Minister, that there was no polling done prior, during, or after
CNS did not conduct polling on that topic, no.
Okay. was there any recommendation from your department, or are you aware that they were thinking of doing
No,
polling?
I'm not aware of any recommendation in that regard. But again, back to my earlier point, there may have been conversations that occurred at the department level that I wouldn't necessarily be aware of.
Would they be able to do polling without you being aware of it, or would you definitely be
No, the
involved in it?
polling now moves through, by virtue of our legislation, communications polling moves through research and evaluation, moves through Communications Nova Scotia.
So you would
So
be
we
aware?
would be aware.
You would be aware. Okay. So you're confident to say there was no polling?
There was,
on Bill? Okay. One of the areas that I know that many people are concerned around is ensuring that the government understands where they're at. So with the opportunity to ensure that people hear about this polling, and I know I'm going to stay on this for a few minutes, would you feel it's beneficial to have that information available to Nova Scotians other than the route of FOIPOP, so the results of focus groups and polling? I mean, I know if I'm asked or I took part in a group session that I would want to know information. So if you're not making it public through online, are you providing people in the focus group a synopsis of what happened and the results of them being involved in that focus group?
that's not typically the way a focus group works. People participate in focus groups on the condition of anonymity, typically. So when a report is written about a focus group, there is no one identified in that report as an example. The earlier part of your question was, I believe you asked me, do I think it's of value for people to be aware? I think, like advertising and publishing our advertising guidelines and producing an annual advertising report, I think all of that lends itself to increased accountability and transparency. So if there is something that we can do in terms of sharing information in an era of more open government, then I think it does make sense to do that.
So with the process of approving messaging and that, I think you talked a little bit about it. So if a department wants to do some polling or do advertising for a certain project or initiative they're doing, so I know that you would have CNS employees in that department, so that they come up with a plan. How does that messaging get approved? Like, is it the department to the communication staff to you and then back? Is that how simple it works?
The messages usually do originate at the department level from the program staff working with the communications specialists in their department. It then works its way through the managing directors that I've referenced earlier, and that information is then, those messages are then shared with other departments that might also be involved in that particular issue to ensure that we're not inadvertently contradicting ourselves, that the communicators haven't written messages that are contradictory. So we do that cross-reference, and then the department ultimately approves that message, and then uses the message if the opportunity presents itself.
Okay. Is there, and I think it was asked already, but I'll ask again, is there one department that utilizes your services more? I know the Department of Health have a number of health communications staff there. But is there one department that actually uses more? Can you tell me, are you able to look at the whatever you call getting the money back from the departments, which department has utilized communications Nova Scotia more over the last 12 months or so?
I would have to go back and look at that to see if I could draw a conclusion from that. I would say you've talked very articulately about health, with which you have a lot of familiarity. Obviously, health, we routinely do a lot of work with health because of things like 811 and 911 and the need to constantly be communicating about health. But it really does vary. To use my road safety example, in the past, maybe transportation and infrastructure renewal wouldn't have been a heavy user of communication services, but because we're focused on road safety, perhaps they'll be using more of our services this year. So it really does vary. Service Nova Scotia also uses our service. All departments use our services. It really does depend on what their objectives are for any given sort of project and within any given fiscal year.
So you had mentioned coming up, there'll be more, you'll be able to tell more about what the budgets are because of legislation that was passed. So, and I think it was chargeback, I was trying to think earlier, you charge back the department if they come up with an initiative. Would it be worthwhile that your department hold the entire budget for advertising? I mean, and then, I mean, it's all taxpayers' money, right? I mean, I would think it would make more sense that if a department has an initiative, and sometimes it's out of their hands, H1N1, for example.
Right.
I mean, you can't foresee that. I'm sure the Department of Health at the time, I wasn't there, but they didn't budget for what was entailed in getting messaging out to the public. So wouldn't it be worthwhile to have the entire budget under your department? And I mean, then you wouldn't have to charge back departments. To me, that I don't find that real, you know, I'm not an accountant, but I think in the accounting way, it would be more beneficial to have it all under one roof. Is that something you're entertaining or looking at trying to do?
The legislation has given us authority over government advertising writ large, which I think was probably the biggest stumbling block to us gaining sort of control over the monies that were expended around advertising. The challenge with trying to move all quote-unquote advertising dollars, I guess, over to CNS would be that it does vary from year to year. It really does. So it depends on the work of that department and what they plan to undertake in the year ahead. Sometimes something pops up. H1N1 maybe wouldn't be the best example, but sometimes something of a smaller magnitude may pop up, and a department might not actually have the advertising dollars to conduct a campaign on that particular issue. That's where we need to look to see if we can find some flexibility in order to help them achieve their objectives. So I'm not certain it would make sense necessarily.
So I know there's been success in some of the campaigns, and one of them that comes to light is the 811. And whenever I know the data that I've seen in the past, whenever an advertising commercial comes on about 811, there's an increase in utilization of 811. Haven't seen too much of that over the last little while. Has there been a request to stop airing certain videos or certain commercials to try to contain costs? Or, you know, for me, that service is important, and especially when you see in rural communities closures of ERs, 811 can be a resource that people can use to try to get more understanding of what's going on health-wise.
Absolutely.
And how what their next step would be, like go to the emergency department, call 911, or so. So I haven't seen too many commercials or advertising, you know, supporting 811. Is there a reason for that?
If my memory serves me correctly, we ran a campaign back in the spring, and we are working with the department now to figure out exactly what other campaigns we'll run through the winter season. Our challenge is to make sure that we don't have too many things going on in market at the same time. So you very accurately reminded us all that flu season is approaching, so we'll be in market with a flu campaign within the next couple of weeks to encourage people to get their flu shot. So we need to make sure that we are using the limited dollars that we have to achieve our objectives most effectively, and that means we can't be in market with everything all at the same time.
Okay. Really, I know I only have a minute or so left, so on the last one is maybe go back to a question. I said I'd wait for the answers. The number of vacancies, were you able to find out the number of vacancies you have in your department?
Right now, we have 4 vacancies.
4. Okay. All right, I'm good. Thank you.
Okay.
Yeah.
Okay, with that, we'll move back to the Liberal Caucus and Mr. Rankin.
Thank you. Just going back to where we kind of started at the beginning with the reduction in staff numbers, I think you mentioned that this was decided with the Deputy Minister on an annual basis. And I'm just wondering, and I could be wrong, but that's what I wrote down. So does the Minister get involved in that process, and is there an opportunity to do it more frequently? Like, and I'm just thinking of certain projects that take on consultation and it lasts a number of months, but then I wonder what that CNS agent staff is doing in that department, if they could be logistically used in another department more efficiently. So why is it done annually? Is there an opportunity to have it more fluid and more iterative, just seeking out more efficiency gains, or is it kind of rigid and every specific year there's a certain date where it's kind of revised?
Okay, so it is absolutely not rigid, but for the purposes of, at the start of each fiscal year, determining the size of the complement that any team anticipates they'll need, a request goes out usually February-ish, I guess, of each, toward the end of a fiscal year, to ask deputy ministers what they anticipate their needs will be. The deputies confer with their ministers to make sure that everyone is comfortable that, yeah, we're going to need 3 resources for the year ahead. Where the flexibility comes in is in exactly the way you've articulated. Sometimes things don't go exactly as planned, and we end up in a situation like your colleague referenced the H1N1, for example. We might end up in a situation where we have an emergency on our hands and we need to deploy more resources to a particular department to fulfill a need. The CNS model is such that those CNS employees can be picked up and moved as the need warrants. So if transportation feels they need 4 resources this year, and halfway through the year it turns out they maybe only feel they need 3, and community services needs an extra communications advisor, we will move that resource mid-year, even a third of the way through the year, over to that new department, either for the balance of the fiscal or until that particular peak in need subsides, and at which point that resource would then return to transportation, as an example. So it is absolutely not rigid. It's very flexible, which is, I think, why it tends to work fairly well, and departments are very collaborative and understanding of the need to send their communicators where the greatest need is.
Okay. And just one more comment and question. You said that the legislation helped clarify the role. So do you feel that the department is effectively fulfilling its original purpose?
Yes, I do. Absolutely. And the legislation certainly gives us the ability to make sure that we are absolutely fulfilling that mandate in all areas, from strategic communications planning, marketing, research and evaluation, media relations, graphic design, all aspects of the work that the agency has been involved in. To this point, the legislation very clearly puts that in black and white, if you will, and ensures that departments now know there is one spot to go to avail themselves of all of those services, which in turn allows us to meet our mandate.
Okay. Thank you.
Mr. Stroink.
Thank you very much for coming in. I see as research and evaluation as a very crucial part of communications in Nova Scotia. So before you're spending hundreds of thousands of dollars on taxpayers on a campaign to do this research and make sure you're doing the right thing, my question is, do you see that as an agreement to that statement, or do you feel that you guys need to go another way?
Absolutely. Research at the start of a significant campaign is fundamental, and the Auditor General flagged that. And perhaps even more important is the evaluation when it's over and done with, to make sure that we have in fact achieved our objectives, and if we haven't, try to put a finger on why we haven't, so that we don't repeat that same sort of error, if you will, in the future, so that we're more effective.
Thank you. Can you give me some examples of future communication that you've based on research that you have done?
Mm-hmm. I spoke already about the road safety campaign. I'll just maybe elaborate on that one just a little bit more. We did intensive research around the road safety campaign before we developed that campaign, I should say, because we really did feel it was important for us to understand where our the minds of youth in particular were. So that research pointed to some key insights in that youth, young people, young males in particular, have a tendency to embark or engage in, I guess, risky behavior, particularly when they're behind the wheel. That behavior is sometimes moderated by whoever is sitting beside them in the car. So my son, if I had one, might not speed if I was sitting beside him, but if his buddy is sitting beside him, the odds of him speeding increase exponentially. The odds of him driving while under the influence increase exponentially. And there is inherent in that age group risky behavior, in particular with males, and that is something that our research pointed to. That research also, shed light on a bunch of other aspects, and in the months and years ahead, we will use that research to try to create social marketing campaigns that can get at some of that risky behavior, because we know they're not just risking themselves, they're risking the lives of many others. The anti-smoking movement is a great example, I guess, of how research informed an international push toward modifying a very risky behavior, but it took a long time to get at that behavior. So with some of these behavior change campaigns that we're embarking on, research is critical to tell us how deep and wide the problem is, and to help moderate, I think, our expectations in terms of how quickly we can get at that behavior. This is very much a long game in terms of behavior change, and we can't expect to flip the switch overnight.
Great. Thank you very much.
Ms. Miller.
When you talk about road safety, you're speaking my language, obviously, and really appreciate that and all your efforts with that kind of research, because it certainly is something I'm very passionate about. That said, we've been talking a lot about what you do for departments as CNS. Do you also do work for individual MLA's offices as well, or is it just strictly departmental work?
Just departments.
Okay, we have more pressing questions, so I'll pass it on.
Okay.
Ms. Lonis-Croft.
Thank you. In your opening remarks, you had mentioned that the campaign for the educational review was done differently. Could you explain how it was done differently, as opposed to how you would have addressed a campaign like that previously?
Sure. In the past, we might have tackled a challenge like that by running an ad in a newspaper, for example, and encouraging people to complete an education survey. In this instance, we took a different approach. So, as you would all be aware, earlier this year, a review of the entire education system was announced, and a 6-member panel was put in place. At that time, the department recognized the need to ensure that we engaged a lot of Nova Scotians in a very full discussion about where our education system currently is and where they would like to see it go. So we, CNS, worked with that department to figure out how to best create awareness for the review, and specifically to target participation in the education survey. That was seen as being a very good way to see what people were thinking about this particular issue. So initially, we set an objective of collecting 10,000 responses to that survey. The strategy that we put in place to ensure that survey reached as many people as possible was that we emailed the link out to stakeholders. We placed the link using online advertising. We used a completely online electronic means to reach people and to encourage people to tell 2 friends, and so on and so on and so on, to try to increase participation in the survey. We, without using a high level of paid media, we implemented this marketing and communications plan that leveraged that network that existed around this particular issue, engaged school principals, parents, students, teachers, and all Nova Scotians in this very important conversation. Our results were excellent. We surpassed our goal with almost 19,000 responses to the survey, which I think forms a nice basis for the panel to take and then consider. And I think as an important comparator, our small jurisdiction, relatively small jurisdiction of Nova Scotia, outperformed other provinces who have undertaken similar education surveys. BC, with a population of 5 million, had only 5,000 completed surveys when they approached the same topic, and Alberta, with a population of 4 million, had 12,000 completed surveys. So I think it's a good example of you don't need to spend a lot of money sometimes if you know what your objectives are and they're clear.
Well, I was one of those people that did a lot of Facebook postings of the review, and I found it, there were key people in my constituency who we sent the link through email to. So where did this idea come from? Was it a collaborative approach by the department and you to get more participation?
It absolutely was. It was a collaborative approach with the communications team in the department, our marketing team, as well as other program area experts within the department to say, okay, what's our goal here? And we need to approach this frugally and as cost-effectively as possible. That was one of the considerations, but the principal consideration was, what are our objectives here? And the objective boiled down to, quite simply, we need to get this survey easily in the hands of people that we need to hear from. And so when you sort of strip it back down to basics, the best way to achieve that objective was a very simple one: using networks that already exist and capitalizing on the incredible sort of passion and interest that Nova Scotians have in the education of our children and our overall education system.
So from a management perspective, would you consider this less labor intensive or average labor intensive?
Probably less labor intensive, because we did some initial work and we kept track of where things were at. But it really was about, you just provided an example of you using your Facebook page. It really was about average Nova Scotians continuing to spread that message. So I would say less labor intensive, because we capitalized on the interest and the goodwill of others.
Okay, thank you. I'll pass the mic over to my colleague.
Mr. McGuire, you have 3 minutes.
3 minutes? Okay, thank you. So what I wanted to, I'll be quick with this. One of the things that I kept, that kind of annoyed me and I kept hearing over and over from people was these giant billboard signs that we would see on the side of the road. And I'll give you an example. Down in my riding in West Pennant, there was a sign that said, this road has been paved by so-and-so and so-and-so. I think the average Nova Scotia understands that government pave roads and government do these projects, and I think the practice started 2 governments ago with these signs. We see them federally, but we started seeing them provincially, and I'm guessing, as someone who worked in communications for over 10 years, that these were strategically placed. There'd be, maybe a little bit of orange or blue in the background of these signs. What was the rationale for these signs? Like, we talk about partisanship. To me, it seemed like a giant waste of taxpayers' dollars. I don't think people need to be reminded who paved their road. So, and I'm using that as an example. So, what was the rationale behind, and what was the reasoning for doing these signs in the middle of a community?
Well, to start, I would say it's important to reference the Auditor General's findings that signage, in fact, was considered through their lens as being nonpartisan in nature. Having said that, our current legislation, and in particular the published advertising guidelines that we have, would prohibit signs like that, billboards, from being erected in any part of the province from this point forward. The rationale in using some of those signs was in an effort to communicate with citizens in those particular areas about the work that their government was doing to pave roads or to construct a school.
But I guess, in your opinion, do we need a sign to tell a community that the road has been paved and who it's been paved by?
We use a variety of means to communicate. Sometimes in the past that may have involved signs such as the one that you're referencing. Yeah. As I said, our guidelines would prohibit signs like that from being used in the future. Every government has its own particular style in terms of how it chooses to communicate and share messages. Prior to the introduction of our advertising guidelines, signage such as the signage that we used for maybe a decade prior to now, yeah, was permissible.
So these signs going forward will not be used?
No, they will not.
And in your opinion, they weren't partisan signs, they were just information signs, letting people know who's paved their roads?
In the opinion of the Auditor General,
Yeah.
the signs were nonpartisan, and as an agency, they were a tool that was available to us to communicate a particular initiative of government, and were entirely permissible under our practices of the time.
So who decided the wording on these signs? So we would see the Premier's name and sometimes an MLA's name or a cabinet minister's name on these. Who decided the wording on these signs?
The wording on signs were decided, as lots of other things are, in collaboration with the department that would have been involved in whatever the initiative was, the communications staff, in terms of making those decisions.
So
Order.
Oh,
I'm sorry, the
That's
time
it.
has expired. Ms. Tawil, we'd like to give you an opportunity to provide some closing remarks.
Thank you. I'll be brief. I would like to close by, first of all, thanking all of you for your questions this morning, and also by thanking my team at Communications Nova Scotia, who are passionate about their work, the province, and the Nova Scotians they serve. They're true professionals, and they've certainly embraced a great deal of change over the past couple of years, and I know received with open arms the findings of the Auditor General's report, and have played an instrumental role in ensuring we fulfill all of those recommendations. Those audit findings will certainly help our agency continue to improve, and as an agency of communications professionals, our mantra is to always be looking at new and better ways to communicate and to ultimately fulfill our mandate. Thank you.
Thank you, Ms. Tawil, and thank you, Ms. White and Ms. Campbell, for being with us today. Our next meeting will be on October 15th. It will be with the Department of Finance and Treasury Board. It is a training session on the public accounts of the province. And there's a lot of information, and I think it serves us all and serves Nova Scotians better if we are trained as best we can be on the public accounts and what they mean and how they're structured. So that's going to take place on October the 15th. It is going to take place in the Johnson Building, so be aware of that. And following this meeting, we're having an in-camera briefing on the Department of Health and Wellness physician alternative funding arrangements with the Auditor General, and that will begin perhaps a little bit before 11 a.m. if we can. With that, we now stand adjourned. Thank you.